This is my case presentation for the case I was assigned from my second field practicum assignment. I was able to pick up a case that I had kind of started last semester. I really only did one visit with them last semester, but my heart just stuck with them, and so my supervisor was able to let me carry that case on through this semester and be like the main case that I focus on, along with all of my other assignments that I was doing with CASA. The client system for this family, my duties primarily focused on the 5-year-old girl, a 3-year-old boy, and a 2-year-old girl. They're all siblings. The 5-year-old girl, she has some behavior problems. She has some issues with authority. She knew she was doing wrong. She can identify when she's had a bad day. She can identify that she's not behaving well, and she expresses a desire to do better. But oftentimes she doesn't. She still continues that behavior pattern that she's had since as far as the grandparents are aware of. 3-year-old boy, he doesn't really show any signs of behavior problems. He's your typical 3-year-old boy. He's respectful when I'm around. He's respectful to his grandparents. The 2-year-old girl, she has some speech issues. She mumbles and doesn't pronounce her words appropriately. And that was primarily due to neglect. Just while she was with mom, they didn't really talk to her, communicate a whole lot during the time that was critical in that development for her. She's only 2 years old. But she's doing speech therapy and improving along with that. And we work on ABCs when we visit. So she's been doing much better with that. So they came into the system. The mother left the 3 children with the grandparents, and after that her location was pretty much unknown for about a week when the report came in to DFACS. The mother resurfaced. She was arrested twice within 2 days for meth possession and criminal attempt to distribute. At that point, she didn't have the kids anymore. They were with the grandparents. She was homeless. She admitting to using meth for at least the past year. The father, he wasn't really in the picture. He wasn't willing to take the kids. At the time, he said that he had work. He wouldn't be able to care for them. He also admitted to marijuana use and being homeless at the time as well. So they came into care of the state in March of this year, 2018, and I've been with the grandparents ever since. And that's ultimately where they've spent their life on and off since they were born anyway. On a micro level, mostly when I came onto the case, it was just the grandparents. Back in May, when I first visited with them, they didn't have a whole lot of visiting with mom and dad. So they had guardianship placement, and that was the grandparents. On a meso level, they have quite a few things to point on. They have counseling. They do Pathways of Hope, and that's all 3 of the children. They have daycare for the 2 youngest. They do daycare through Baby Love, and they get some homework help and assignments and learning alphabet and numbers and counting and colors. They've been doing really well there. And they all kind of work together. DFACS communicates with Baby Love, and the counselors, you know, kind of let grandparents know what the kids' needs are at that time. When first coming on back in May, and still now, kind of, I just don't feel like the mom has taken what DFACS and her caseworkers have been telling her and what she's supposed to be doing seriously. I feel like she's been doing the absolute minimum to get by so that she can get her kids back. She just doesn't I guess she doesn't get it in regards to what it takes to be a parent. She talks a lot about wanting to be a cool mom, and she talks a lot about making sure the kids have fun, and that, you know, they're always having fun and, you know, enjoying their time with her, and that's important, but that seems to be her primary focus. There isn't, with the visits, a whole lot of discipline. There isn't a whole lot of direction or instruction, or if they're kicking and screaming and, you know, telling mom no, there's not really any correction. She deals with it until they stop behaving that way, and then, or she'll distract them with a pillow fight, or, you know, something like that. She doesn't really draw the lines there as far as, I'm your parent and we can have fun and that's okay, but you still have to respect me. There's just not a lot of, I guess, understanding that responsibility, and they're not, there isn't the maturity there that's needed to be. Not that she has shown anyway, and really just the desire to be a mom and not just a buddy hanging out. It's like she doesn't grasp, these are your kids to take care of, not just bounce through life with. The strengths of the children, my primary focus really for the case is, if I had to pick one word, it would be resilient. They have dealt through pretty much almost abandonment from both of their parents, drug use, so who knows what was going on in that house, neglect, possible sexual abuse going on, just pretty much chaos. And despite all of that, you know, they're pretty good kids. You know, there's going to be some behavior issues, that's an understanding, but overall they're really good kids. They're respectful, they're playful, happy. I think with some direction in on the oldest kid's case, and someone, you know, proving that they're going to be there even when you mouth off and are disrespectful. They're not just going to run away like mom and dad did. I think, you know, that could kind of change. They're resilient. They're strong as hell. And my little heart, I love them. Plan of action for this family was ultimately reunification. And that's really the starting point for every case that comes through DFACS is reunification. Mom, they needed mom to be clean. They needed her to test negative for meth and any other drugs that could be in her system. They wanted her to take parenting classes, complete those classes, display an understanding of what she had learned. Housing, she was homeless at the time that the kids came into care. So she needed to get her own housing and get the kids back in the home. That was ultimately the game plan. And if all of those things worked out for her, if she was able to get all of that done, but more than likely the kids would end up back in her care. Progress is monitored through CASA visits. We come visit the kids, see how they're doing, as well as meetings with DFACS. Mom has meetings with her caseworker. We have proof of housing. She was able to establish government housing. We have proof of that. We've been trying to get a visit out at the house since that has happened. It's a little more recent though. The completion of the parenting classes, that's something that's easily observable. And of course the negative drug test. She had to stay clean and sober. CASA visits, we like to spend, or we required to spend at least 5 hours per month on that case. Preferably with the kids, because that's ultimately what we're there for. And we do that before every hearing, before every court hearing. Before we even look at the report, we have to lay eyes on those kids. We can't submit a report to the judge for that hearing on that case without seeing the kids. So that's a really important factor. Even if there's nothing specific that we're checking to see, just see how they're doing, how life is going. And for the older kids, not necessarily my case per se, but older kids, we ask them, is there anything you want us to bring to the judge? Is there anything that you want him to know? And stuff like that.